Assalamu alaikum. Myself Umar Farooq, 2021 DBM 016, Group A1 Morning, DBM 5th year, and my case study is Juvenile polypoid endometrial stromal tumor in a thoroughbred filly. A 425 kg yearling thoroughbred filly was presented with a history of reluctant to stand, bloody discharge from the vulva, which was observed 1 to 2 weeks prior, and it was prepared for the race trail. Then the clinical examination was performed and the filly was dull but responsive, and its heartbeat was 60 beats per minute, respiration 30 per minute, and temperature was 38.3 degrees centigrade. But the mucous membrane, capillary fill time and the gut sound was normal, but there was the serosanguinous discharge from the vulva and uterus and cervix was normal. Then the filly was sedated with the xylazine 100 mg IV, butarphenol 10 mg IV and the diazepam 5 mg IV for the further examination. Through the speculum examination, pink red fluid was at the vestibulo-vaginal junction, but the vagina and cervix was normal. Then the rectal palpation was performed after the hyoscine 20 mg IV, and there was a rubbery mass in the left dorsal region. And through the ultrasound examination, there was a 8 cm tubular heterogeneous mass in the left uterine wall. In the hysteroscopy, there was lobulated grey white to red dark purple mass just caudal to cervix. Then the biopsy was performed. A sample was collected manually, removing a portion of the intrauterine mass, and the sample was placed in the neutral buffer 10% formalin solution and subjected for the histological examination. The following morning, the filly had the sign of the colic and the pyrexia, and it was believed that it is due to the response of the bacteria released from the tumor and also due to the sepsis attributed to the histoscopy. But the filly responded well due to this treatment. Flunixin meglumine 500 mg IV once and 3-day course of penicillin G procaine 9000 mg IM repeated after 12 hours, gentamicin 3000 mg IV repeated after 24 hours, oxytocin 10 unit IM repeated after 6 hours, and phenylbutazone 1000 mg per oral repeated after 12 hours. The histopathology was done. The tumor was made of spot tissue filled with a lot of small similar looking cells that were either spindle shaped or satellite. These cells were spread out in layers. Cells in this sheet were interspersed with edematous area that had cells rearranged in a network. Mildly cystic gland and surface epithelium were visible in some areas, but a large part of the tumor was dead. It turned black and blood clots blocked the blood supply. Bacteria were living inside the clots and spreading all throughout the dead part. Immunohistochemical analysis revealed spindle-shaped tumor cells with positive staining for vimentin and desmin, but negative staining for factor VIII. So it is a mass of muscle origin. Initially, it was diagnosed that it is a case of juvenile uterine leiomyoma, a smooth muscle tumor with severe necrosis, bacterial infection and inflammation. But it was revised that it is a case of juvenile polypoid endometrial stromal tumor, a rare benign growth from the uterine lining sportive tissues. Then treatment: 17 days post biopsy, the tumor was removed manually, cervical and under the sedation, and it was removed in the small pieces, and it was about more than 2.5 kg as shown in the figure, and antibiotic and NSAID was given prophylactically. Then follow up: 8 days post removal, blood clots and pedicle remnant were removed manually, and 15 days post removal, ultrasound was performed, and there was 43 mm follicle on the left ovary, and there was uterine edema but no fluid, and histoscopy confirmed that there was healthy uterine mucosa. And there are the few important points from this case study, as neoplasia is rare in young ones, and hemorrhagic discharge from the vulva is not always because of the neoplasm. It may be because of the reproductive or urinary issues. And in male, the most common reason from hemorrhagic discharge from the vulva is bleeding of the vestibulo-vaginal varicosities. Outcome: filly was discharged and raced 7 years with wins, and then retired for racing. But after this treatment, the owner didn't notice any kind of the issues. Thank you very much for your attention.